and I need to stop talking during the new announcement, and I will turn things over to Bryan. Ooh, and Bryan, you are muted.
There we go. That should be better. Sorry about that. I'm sure I'll get a hang of it by the time the pandemic is done. Anyway, I was saying, hello, everybody. I'm Bryan Weiner. I'm a professor in the departments of Global Health and Health Services at the University of Washington. It's my pleasure to speak with you about assessing multi-level contexts, contextual factors. I'm coming at this topic as an implementation scientist, but I think what I have to say is relevant for those of you who are working in other disciplines and fields. I say this because regardless of the field of study, measurement or assessment is one of the most challenging components of research design, and simultaneously one of the most important, given that science is measurement. So over the next 20 minutes or so, I'd like to do the following, and I'm going to do this fairly quickly. I'm going to speak at a very high rate of speed. However, the handout provides a nice summary of what I'm going to say, as well as lists some of the resources, the citations of the articles that I mentioned in my presentation. If you have a chance to grab that, as well as the activity that's part of the download during this session, that would be great. So we'll move into an activity immediately after my prepared remarks. So over the next 20 minutes, I'd like to do the following. Describe approaches for assessing multi-level contextual factors, describe some tools for assessing those multi-level contextual factors, discuss some measurement issues in the field of implementation science, and then survey the state of measurement in this field. And then I'll conclude with some suggested measures. So when it comes to assessing multi-level contextual factors, there are three general approaches: qualitative, quantitative, and mixed methods. The qualitative approach is the most predominant approach in implementation science. And in most published studies, multi-level contextual factors are assessed through interviews, focus groups, and observations. The quantitative approach is less often used due to data and measurement limitations, some of which I'll cover in a few minutes. Although less often used, you do see measurement or assessment of multi-level contextual factors through surveys, administrative data, and secondary data.
Bryan,
yes?
Sorry to interrupt your very high rate of speech, which is excellent. But when you unmuted, we lost your screen share.
I'm sorry about that. Let's see here. Let's try one. How about now?
Perfect.
Thank you, and my apologies for the mix-up. Okay, so mixed methods are increasingly common in implementation science. For example, you might find published studies where contextual factors at one or more levels are assessed qualitatively, and contextual factors at other levels are assessed quantitatively. I'm not going to discuss or focus too much on mixed methods in this talk. Instead, the remarks that I make will be about qualitative and quantitative approaches, which of course will apply to mixed methods approaches as well. Now, I'd like to talk a little bit about some of the tools that are available for assessing multi-level contextual factors, and I'll do this by describing tools that are available for commonly used multi-level contextual frameworks in implementation science. The Consolidated Framework for Implementation Research offers a pretty robust qualitative set of assessment tools. If you go to cipherguide.org, you can find interview templates, coding guides, and rating systems. And although I favor other determinants frameworks, I often recommend the CIFR, or Consolidated Framework, because it offers a turnkey solution, a package of assessment tools that support consistency in data collection and analysis, as well as cumulativeness in research findings. There are some quantitative assessment tools out there. There are self-report measures for many CIFR constructs, and the Society for Implementation Research Collaboration, their instrument review project, reviewed dozens of measures and tools out there for their psychometric and pragmatic properties. There's a published collection of the reviews available that the CIRC IRP project has generated in the journal Implementation Research and Practice. And you can also find self-reported measures scattered in the literature. For example, Maria Fernandez and other colleagues have published an article a few years back with measures of the inner setting that have been tested in federally qualified health centers around colorectal cancer screening. The PRISM, or Practical Robust Implementation and Sustainability Model, is an interesting and, in my opinion, underused multi-level contextual framework. The original PRISM article contains a question checklist, which can be very useful for planning and guiding an implementation effort. And a published study using PRISM assessed multi-level contextual factors through interviews, focus groups, observations, and some secondary patient-level data. Then there's the TICD checklist, Tailored Implementation for Chronic Disease Checklist. I really like this multi-level contextual framework because it includes more contextual factors than the consolidated framework, including several that are especially relevant in healthcare contexts. The original TICD checklist article includes, not surprisingly, a question checklist. And I found a published study that used self-report measures for selected constructs. It's listed on this slide. Many of you have heard of EPIS, the Exploration, Preparation, Implementation, Sustainment Framework. Greg Ahrens, the developer of EPIS, has assessed the multi-level contextual factors included in the framework through interviews and focus groups. And I found a published study that used self-report measures, administrative/program data for some of the constructs as well. The TDF, or Theoretical Domains Framework, synthesizes and harmonizes dozens of constructs from psychological and behavioral theories. And like the consolidated framework, the TDF offers an interesting package of tools. It is linked to an inventory of behavior change techniques and strategy selection tools called the behavior change wheel. There are some self-report measures out there for TDF constructs that have undergone some reliability and validity testing. Others have assessed these multi-level contextual factors in the Theoretical Domains Framework through interviews and focus groups. And finally, there's the Health Equity Implementation Framework. This is perhaps the newest kid on the block, but highly relevant for assessing historical, cultural, economic, political, and cultural factors that influence implementation. The original published article used interviews to assess multi-level contextual factors, and the Phoenix toolkit contains quantitative measures of individual and structural social determinants of health, which can also be useful. So what are the advantages? There are several advantages for going qualitative in your approach. Generally speaking, it's quick and easy. Not to say it's totally quick and easy. Generating a really good interview guide and a really good coding manual does take some time, but compared to developing and psychometrically assessing and testing quantitative measures, I would say it's quicker and easier. Going qualitative also works well with small samples. There's a potential for richness and depth and nuance in the data that you can collect that way. And the actual process of collecting the data themselves through focus groups and interviews helps to build rapport between researchers and study participants. And also, I think, fosters a sense of empathy when you get a chance to step into other people's shoes, to mix metaphors a little bit here, and see the world from their perspective. There are some disadvantages, which are worth noting. Aside from the consolidated framework, there are very few templates for interview guides and code books associated with those frameworks that I just talked about. The interview guides and code books that researchers have developed in their own studies are often not publicly available. It can be really challenging to write interview questions for abstract concepts, something I learned in an earlier research project I did a few years back, trying to get at this construct of implementation climate. Turns out that's really hard to write interview questions that really generate good data for that. And then finally, it can be really challenging to code abstract concepts in the natural spoken language that interview participants use. Again, people don't use terms like implementation climate or leadership engagement or other sort of technical or scientific constructs that we use in implementation science. And it can be challenging to sort of translate or interpret the natural spoken language that interview participants use or focus group participants use into these constructs. There are many advantages to going quantitative. I'm not going to enumerate them, no pun intended. Instead, I'd like to discuss the state of measurement in the field of implementation science and highlight some of the challenges of assessing multi-level contextual factors when you go quantitative. Now, before we look at the state of measurement in the field of implementation science, let's talk about what makes a measure a good measure. What do we want in measures? We want three things. We want them to be reliable, valid, and practical. Reliability, as many of you know, concerns the quality of measurement. In its everyday sense, reliability is about the consistency or the repeatability of your measures. And there are several forms of reliability. There's inter-rater or inter-observer reliability, test-retest reliability, parallel forms reliability, and internal consistency, which is probably the most commonly assessed form of reliability, often through the computation of Cronbach alpha. But these other forms of reliability are also important. For example, if you're using an observational tool to assess the fidelity of intervention delivery or even the fidelity of implementation strategy deployment, then inter-rater or inter-observer reliability becomes very important. We also want measures to be valid. Validity concerns the accuracy of assessment. In its everyday sense, validity is about whether your measure measures what it purports or intends to measure. At one time, measurement experts talked about different types of validity, but nowadays, measurement experts say there is only one type of validity, that's construct validity. Construct validity, simply put, is an assessment of whether the measure in fact measures the construct that it purports or intends to measure. So the list you see here are not different types of validity, but rather different forms of evidence for construct validity. And we also want measures not just to be reliable and practical, but we also want them to be pragmatic or practical. That is, we want them to be useful and easy to use. A practical or pragmatic measure is one that measures something that is important to stakeholders, that imposes a low burden on respondents or staff, that can be acted upon, and can tell us when something has changed. Now, an aspiration for implementation science is that practitioners will use measures to assess their implementation context, to monitor their implementation efforts, and to evaluate their implementation outcomes. However, practitioners are not going to use measures if those measures are not practical, no matter how reliable or valid they might be. And researchers too, though, care about practicality. Our research suffers when practitioners perceive measures to be irrelevant or burdensome, for example. There are other qualities that make a measure practical, but these 4 qualities are a good starting list. So in implementation science, the constructs that interest us most fall into 3 categories. There are determinants, processes, and outcomes. And I've listed some of the conceptual frameworks commonly used to get at these categories. The SIC, or stages of implementation completion, might not be as familiar to you as the consolidated framework or REAIM, but it is one of the few frameworks for which we have measures that we have in the field for assessing implementation process. I've also listed several constructs from these frameworks, but note there are 2 types of constructs here. There are manifest constructs. Those are things that are directly observable, and those are indicated in red font. And then there are latent constructs. These are things that are not directly observable, but that we think exist. There are some common measurement challenges for both manifest and latent constructs, but there are several distinctive measurement challenges for latent constructs, and this is particularly important in implementation science, as many of the constructs that we care about cannot be directly observed. Instead, we can only infer their existence and strength by measuring indicators that reflect their presence or their operation. So when we measure latent constructs, we look for their hidden but causal effect on observable indicators. And this indirect method of measurement gives rise to this fundamental concern about construct validity, which is, are we in fact measuring what we think we are measuring, and how do we know whether we are? So what can we say then about the state of measurement in the field of implementation science? Well, I had the privilege of participating in the instrument review project led by Kara Lewis and funded by the National Institutes for Mental Health. And through this project, we reviewed hundreds of measures used in mental health and behavioral health care to capture implementation context, process, and outcomes. I will have more to say about the instrument review project in a few minutes, but here I just want to summarize our observations on the state of measurement in the field of implementation science. In the process of reviewing those hundreds of measures, and I do mean hundreds, we observed the following instrumentation issues. First, measures are poorly distributed across the constructs of interest in implementation science. For some constructs, we have dozens of measures, and for others, we have few or none at all. Second, many measures have unknown or dubious psychometric quality. Few measures have undergone systematic development and testing processes, and as such, their psychometric properties are largely unknown. Often there is limited information about reliability or validity, and the information we do have suggests low or maybe modest levels of each. In part, this problem arises because many measures in implementation science are used once and never again. And this proliferation of single-use measures is itself a problem, but it contributes to this problem of limited information about reliability and validity. Third, measures exhibit, and let's see if I get this right, synonymy, homonymy, and instability. Try saying that 3 times fast. That is, we see the same items being used to measure different constructs, different items being used to measure, quote, the same construct, and changes to items with each use of the measure as researchers adapt and make changes to them. So for example, the range of items used to measure organizational readiness for change is breathtaking. Often there is very little overlap in item content across measures of readiness. Not only that, the items used to measure readiness are often used to measure other constructs like organizational culture or management support. And it is very tempting, and it often occurs, that researchers will add, drop, or modify items in a measure to make it more specific or tailored to their research study. And these 3 problems create serious doubts about the construct validity of our measures. Simply put, we can't be sure that we are in fact measuring what we think we're measuring. Fourth, many measures are not practical. Implementation scientists have not prioritized practicality in measurement, and as a result, many of our measures are too long, too complicated for practitioners to use. And then finally, as a sidebar, I'll note that the psychometric properties of our measures are often very poorly reported in research studies, in our peer-reviewed articles, and the measures themselves are hard to find because they're poorly indexed in our bibliographic databases. And this makes it really hard to find reliable, valid, and pragmatic measures, those even that do exist. Now, those are some pretty bold claims, so let me bring the receipts. I'll start with the measure review by Karen Emmons and her colleagues, published in 2012. They identified and evaluated 36 measures spanning the constructs of leadership, vision, managerial relations, organizational climate, and absorptive capacity. Now, these constructs are all located in the system readiness domain in Trish Greenhall's implementation framework. Only the measures of leadership and organizational climate demonstrated some evidence, any evidence of both reliability and validity. Across those 5 constructs, the authors found, number 1, no measure was used more than once in any study. Number 2, most studies did not include reports of the measure's psychometric properties. Number 3, some studies, some were based on a single response per unit. That would be like having an organizational manager report on the organizational readiness for the entire organization, which is problematic. And fourth, the levels of the instrument and the levels of analysis were not always compatible. Given these 4 issues, the authors noted that they were unable to offer any recommendations for using the identified measures to evaluate the 5 constructs of interest in that article. In 2013, Chadwar and her colleagues published a review of measures of factors affecting the implementation of health innovations. They identified 62 measures of constructs within organization, provider, innovation, structural, and patient-level domains. Their item-level analysis of psychometrics centered only on predictive validity. That was the only form of evidence for construct validity that they examined. They didn't look at reliability or any other evidence for construct validity. Their review revealed that almost half of the identified measures did not include an assessment of predictive validity in their original validation studies or in any subsequent study that used the measure. Of the measures that did assess predictive validity, adoption and fidelity were the only implementation outcomes examined. Their review also uncovered that the constructs at the level of organization, provider, and innovation had the greatest number of measures, while the structural and patient level domains or constructs were less saturated. So remember what I said earlier about measures being poorly distributed across constructs of interest in implementation science. Additionally, of the 62 measures that they identified in their review, only 21 had 21 had only one associated citation. Again, there are a lot of single-use measures out there. And moving along, Chor and colleagues identified 118 measures that assessed 27 predictors of adoption. they found that the measures were unevenly distributed across the predictors, with external environment constructs having the most measures and social network constructs having the fewest. They observed multiple definitions of a single predictor in addition to multiple forms of measurement. There's that synonymy and homonymy problem I mentioned earlier. With respect to the psychometric properties of the 118 instruments, about half, only about 62, reported any information about reliability or validity. And note that these authors simply reported whether or not there was any information or evidence about reliability or validity. They did not delve into the level or the strength of that evidence for reliability and validity. And finally, I've mentioned the instrument review project. This project identified and reviewed the psychometric properties of more than 420 measures used in mental health and behavioral health care. The project was guided by the Consolidated Framework for Implementation Research and Enola Proctor's outcomes framework. As I've already noted, we have observed great variability in the number of measures distributed across constructs in the consolidated framework. For example, the CFR domain characteristics of individuals had about 56 measures for the knowledge and beliefs construct, just for that one construct, 56 measures. By comparison, the CFR domain outer setting contained only 4 measures for the 4 constructs in that domain. And for 2 of those constructs in that domain, external policy and incentives, as well as peer pressure, there were no measures. With respect to Enola Proctor's implementation outcomes framework, we identified 104 measures that were unevenly distributed across the 8 implementation outcomes. The construct of acceptability had by far the greatest number of measures, about half, if I recall correctly. Only one of the 104 measures had been through any sort of systematic review process and development process, and that had information about internal consistency, structural validity, predictive validity, norms, responsiveness, and usability. And unlike the previous reviews that I mentioned, here we actually went beyond just assessing whether any evidence of reliability or validity was available, and went further to actually rate the strength of that evidence, the psychometric properties of these instruments, using a 4-point rating scale that was tailored to each of these different types of evidence of construct validity. And across all 104 measures, only about half were rated good or excellent for reliability, 17% were rated good or excellent for structural validity. That would be around factor analysis, for example. Only 9% were rated good or excellent for predictive validity. Now, although the state of measurement in the field of implementation science could, let's just say, have some room for improvement, I don't want to leave you with the impression that there are no good measures out there. This is just a partial list of measures that have some strong psychometric properties and pragmatic properties. And let me also point out, as I said earlier, that Maria Fernandez, Michelle Kegler, and others that are involved in the Cancer Prevention and Control Research Network have produced some measures of the inner setting from Consolidated Framework and tested them in the context of colorectal cancer screening in community health centers. So clearly more work needs to be done, but we are moving in the right direction. And with that, I'm going to conclude my whirlwind tour of approaches and tools for assessing multi-level contextual factors. And let's see, we have about 12 minutes, if I'm not mistaken. What I would like to do is ask Daniel to, like to do is a little exercise. One of the handouts that was provided, and hopefully you've had a chance to download it from the website, includes a little exercise asking you to write, draft some items for the construct of leadership engagement. Given the amount of time that we have available to us, my suggestion is that we're going to send you all into breakout rooms in pairs. And I would suggest either writing items, writing questions on the qualitative side, qualitative interview questions, or survey items. There's not going to be enough time for each. Your choice as to which one you want to try your hand out. We'll do that for about 6 minutes. And then I would encourage you to go ahead and stop and then share what you have with your partner, and think about whether or not the questions that you've come up with, the interview questions or the items you've written, really capture the fullness of that multidimensional construct of leadership engagement. So with no further ado, we'll come back, and if there's 1 minute left, just to touch base. But Daniel, if you could go ahead and assign people. Looks like some are coming and going, but let's see if we can make this work.
Okay. Just gonna get everything set up. Great. Okay. And we
I
should.
put the link in the chat there for the fillable PDF.
Thank you very much.
Thank you.
Okay, there might be a couple breakout rooms with 3 people, but that is just
No
math.
worries.
So have a good conversation, everyone.
I got a sign, but I'm just going to hang out.
Yep. Yeah, it just sometimes it just does that with co-hosts.
No worries.
I'm gonna try making sure that people who let's see, is there anyone else that ended up by themselves who I can move? Okay, I think everyone is now paired off correctly.
Perfect. Thanks, Daniel. And could you send a general message to all the rooms at the 6-minute mark, asking them to go ahead and start sharing with their what they came up with each other?
Sure.
Thank you.
Okay, and we'll just say we're at 6 minutes, something like please begin to share your reflections. Does that sound reasonable?
That sounds great. Thanks, Daniel.
My person left, so I'm back, but I'm muting.
That's fine. Okay, and it'll take about 30 seconds to close the breakout room. So should I bring
Perfect.
up?
That was awesome, Brian. I think that was a fun little activity. Thank you for planning that and for everything you brought to the session.
Well, thank you all. Just as a concluding remark, I would say, given the current state of measurement in the field, which definitely, like I said, could use some room for improvement, and some of us are working on that, I do really recommend going more qualitative. I think several of the frameworks that got mentioned today have question checklists and other tools that can be really useful in practice for guiding planning and guiding an implementation effort. And then several of the other frameworks have interview guides, templates, or other associated tools that I think would work really well for research purposes. I encourage you to make use of the few reliable, valid, and pragmatic measures we found out there. But at this point in the state of the field, I really think the qualitative approach, or maybe multi-method approach, may be best. Again, thank you all for your time, and enjoy the rest of the conference.